Hello, everyone. Good morning, colleagues. My name is Olaide Akoni. I'm reaching you from Lagos, Nigeria. It's good to have you again with us on the show today. For those of you who are joining for the first time, this is VUKA Africa. The show is VUKA Africa, and VUKA means Rise Up Africa. This is a show that is put together by the Global Fund Advocates Network, which is hosted by WACI Health, and the whole idea of this show is to raise important issues on HIV/AIDS, TB, and the malaria response that we want to draw attention of policymakers and key stakeholders to. Today, we're going to be discussing a very important issue, which is about human rights and gender concerns as it relates to health. And with me to discuss on the show today is the executive director of IANASO, which is based in Tanzania, Olive Mumba. Olive, you're welcome to the show.
Thank you so much, Olaide. I
Great
hope
to
you're
have
fine.
you. Yes, I am. Good to see you, even though it's virtually, but good to have you today.
Thank you, and thanks for having me on the call. Good to see you too.
All right.
It's been a while, but glad that we can at least be on the show together today.
Yes, thank you. And thank you once again for joining us. So today we'll jump right into our discussions, which is on gender and human rights. And I'll start with my first question. So we hear a lot about, oh, we need to address the human rights dimensions to this, the human rights dimensions to that. So when we talk about health and specifically HIV, TB, and malaria, what are the human rights issues that we need to be addressing?
Okay, thank you so much, Olaide. What I wanted to do is, first of all, define human rights in terms of in the context of health. And we all know that human rights is about everyone being able to access health services, even though, in terms of accessing, in terms of affording, and that those health services should be available, but also that they should be of high quality. We've seen in the past where we've seen health services not being of the same quality, regardless of the area where you live. So right now we're also talking about making sure that they are of quality, that the side effects are manageable, and that everyone, regardless of the differences that we are in terms of age, sex, in terms of our economic and social cultural background, religious background, sexual orientation, gender, that those are not factors that bar us from accessing health services. And this also talks around that everyone has the right to health information as well as accessing health services in every country. And it is the role of governments to provide health services to their citizens. Thank you so much, Olaide. That is what I wanted to say. And in terms of COVID, we have seen how HIV, TB, and malaria services, health services have been a big issue, especially the continuation of health services, especially for the key and vulnerable populations, adolescent girls and young women, and people with disability. Yeah.
Thanks, Olive. And thank you for taking out time to define for us what human rights means in the context of these diseases. Can you give specific human rights challenges that people encounter? For instance, when it comes to accessing HIV services or accessing TB services, what are the human rights challenges that people who are most affected encounter?
The very biggest one, the very first one, is stigma and discrimination. As I mentioned, most of the times people will discriminate on the criminalized populations. When I say criminalized, I'm talking about sex workers. I'm talking about people who use drugs. I'm talking about key populations from the LGBTQI, which are the lesbians, gays, bisexual, transgender, queer, and intersex people. And also, we know that these are criminalized, and as such, even in the past, before COVID, there were already challenges for them to access health services. But right now, because of COVID, that has even made it even bigger because of the laws and policies that exist in our various countries. I'm also going to talk about like sex workers. You find that because of the work that they are engaged in, they are not able, they were not able to make money, and as such, not being able to make the living. And as such, this affected their households. They were not able to get money to pay rent, money to buy food for their children. And even for people who use drugs, they also required appropriate nutrition. So the very first thing is stigma and discrimination. Even for adolescent girls and young women, where we see that there was an increase in gender-based violence, and that also you find that they were not able to access health services in the times when they really required it. And because of COVID, we saw an increase in rape against young women, and that because of the lockdowns, they were not able to get to health services or health centers in time. The other thing that I wanted to talk about was affordability in terms of being able to, when you need to go to a hospital or to a healthcare, you need to get there first, and that means transport. During lockdown, we saw that in some instances where there was total lockdown, there was not, the public transport system was actually literally closed off. So you used, even your own private cars were not allowed to move from one place to the other unless you got you got some, like is it a permission authorization? And this is for some countries. Not all countries had the same reaction. So in some countries where there was total lockdown, you find that was a very big issue, transport from one place to the other. And we saw like women who were giving birth, who were supposed to be giving birth, finding a lot of problems and challenges. Women were giving birth from home because they couldn't access maternity services, health services. And then there's also the fact of nutrition. I talked about lockdown. Women were not able to go, women and men were not able to open markets. And even those that were selling their wares, they couldn't sell their wares. So it was a big challenge accessing nutrition. And especially for those that are on treatment, TB treatment, HIV treatment, we know that nutrition is a very big issue, and that you cannot take your drugs if you're not on nutrition. Otherwise, you get after effects as well. The other thing that I also wanted to talk about was the quality of healthcare. Because of the protective gear, we found that sometimes people were not able to go to referred to a higher health center just because of the restrictions that were there, and also the movement, but also in terms of the protective equipment. So affordability, all that falls under affordability. The other element I want to talk about is gender roles and responsibilities, where we talk about gender-based violence against women, against children, against even young boys. And because of people being locked down, we also see that mental health issues were not being addressed. All that is around human rights. So all that are challenges that we were facing. There was also intimate partner violence. If at home, if you find that maybe one is working, between the husband or wife, or one of the partner is working, you find that when, at least at home, you know that there's going to be food at the end of the day, or there's going to be money at the end of the week or a month or the day. But when now there's total lockdown or there's partial lockdown, you're not assured of funding, you're not assured of money. You find that people start quarreling over small issues. And we've seen a lot of intimate partner violence. Yeah, harmful practices. That was on the increase in terms of culture, the harmful practices. We see that some of the cultures were actually being propagated during the COVID period, where we found most of the times it was around women or around the girls being being disadvantaged. Yeah. So, and then the last one that I want to talk about is policies and legislation. We know that the COVID era came about. We saw our governments coming up with strategies and policies. And most of these did not consider human rights. And it's because this was an emergency situation. So by the time things started moving, no one considered human rights and no one considered gender during the programming or during even the setting of the country committees that were being formed. And as such, we saw a lot of human rights violations. So Olaide, I can talk and talk and talk. So let me hand over to you.
Thank you very much. That has been very, very elaborate. You have highlighted the various human rights violations that people have encountered. And I like the fact that you also highlighted that, the human rights violations differ from population to population. So for young women and girls, for people with disabilities, for sex workers, for MSM, and for other populations, there are also all different human rights violations that they encounter. So we cannot push for a one-size-fits-all approach to addressing these human rights barriers. So in wrapping up, what kind of programs do you think that our health programs, our health ministers, our policymakers need to be putting in place? Because you made mention of one important thing. You said that in the initial design of the COVID response, many of the countries did not take into cognizance the human rights dimensions. Now that we have a clearer picture of what the human rights dimensions are, what kind of programs do you envisage, or do you foresee that governments need to put in place to address some of these challenges that you have highlighted?
Thank you so much, Olaide. The organization I work for, IANASO, we host the Anglophone Africa Community Rights and Gender Civil Society platform under the Global Fund. And we work in 25 Anglophone African countries. And we all know that within the Global Fund, there is what is called the Resilient Sustainable Systems for Health. This is acknowledging and the need to make sure that our country that sorry, I got distracted. Acknowledging that our countries need to have resilient and sustainable systems for health, which can be able to not shake when a pandemic like the way COVID came in. And even our systems were not even ready. So the very first thing is to make sure that we have health systems that can resist anything that comes in. We've seen Ebola come in. We saw other pandemics come in, and COVID really shook and has shaken a lot of our countries, and especially for us here in the developing countries, the implementing countries, we know that HIV, TB, and malaria still remains a big issue. And we need to make sure that we sustain and we continue the services. But I want to mention that as part of RSSH is in the community system strengthening. When I talk about community system strengthening, is making sure that as we are developing the systems for health, there is that sector for the communities, because communities are the very first to react to such issues. Even as we saw in some of the countries, we saw the communities going to actually deliver services like food, medication, HIV treatment, ARVs, antiretroviral treatment, TB treatment, malaria. They continue providing those from their own small budgets. And that is because there are systems which are community-based. As we talk about community systems, we are also talking about community-led monitoring systems. This means that communities are able to identify what are the key issues, what are the key challenges they are facing at country level, and then at the community level as they access health services, and then they're able to report on those issues. And then the programmers and the policymakers are able to readjust or reprogram or review the policies that are being developed, such that the policies and programs are more reactive to the needs of the communities. The other thing is ensuring that communities are able to engage with the decision makers based on the evidence and data that they have collected, and that they influence the policies, both at local level and even at international level, like we see Global Fund. But also giving the communities a voice, being able to engage at all levels. So for me, those are some of the key areas. Coordination of communities should be maintained, making sure that communities are not isolated, that I'm HIV, I'm malaria, I'm a sex worker, I'm a person using drugs, but we should be looking at communities and responding, especially when it comes to pandemics, in a united manner. The last thing I would want to talk about is information. We know that information is power. So communities being able to access credible information, because we saw with COVID, we got all sorts of information that has not been validated. So that is also something I would really like to stress. Thank you. Over to you, Olaide.
Thank you. So we have one of our viewers on the show who has a question for you, Olive, because she is, and it's Faith Mwende. She's asking, how can we ensure COVID-19 prevention measures are taken and at the same time ensure that people are not deprived of basic services? For instance, we have women who are going to the hospital for antenatal clinics or even for delivery who will not be allowed in without a mask. This is even put in place. They have posters created at health facilities to ensure that people are notified. But sometimes people still show up at the facility. They don't have the required preventive measures. They haven't taken preventive measures like wearing a mask. How do we create a balance with this? And the second question is about accountability of funds dedicated to COVID-19. How do we ensure that state actors are utilizing those funds judiciously? Over to you, Olive.
Thank you so much, Faith Dungu, for the question, which reminds me of around 2006, when we had the high-level meeting report. And I remember being in Nairobi where we were discussing that report for, around criminalization in terms of who has the liability to protect the other. Is it the person with HIV, or is it the person that the person is affecting? And in our discussion, we said that for those, everyone has responsibility. Each individual, you have responsibility for your health. First of all, the person who is negative should make sure that they remain negative. As such, you should not put your responsibility to the person that is positive. So the person that is positive also has responsibility not to infect others. But that doesn't mean that we should be criminalizing HIV. Similarly, on your question around masks, how do we ensure that there is a balance? I think for me, it all goes back to responsibility. As an individual, first of all, you need to protect yourself before you think of who is this person protecting me, or is this person infecting me? So whether you go to a place where you know that is high infected, you need to make sure that you are protected, because you never know. With COVID, it's in the air. So the very first thing is, it's up to you. You need to make that decision, and because as we live, the air we breathe is a risk on its own. So every place where you go, you need to make sure, am I safe in this place? If I am not safe, do I need to wear my mask? It's not the other person's responsibility. But then the other thing is, you also need to look at the areas, like if you're going to a hospital, for sure, you have to wear a mask. If you're going to a place that involves a lot of import and export, things coming in from other countries, of course you have to wear a mask, because you never know how you can get COVID. But if you're going to a very congested place, like in a market area, you have to wear a mask. So even if your country says, now we're moving from high lockdown to whatever they classify it, it's your responsibility to know, I want to remain COVID-free, or I want, so you need to make sure that you protect when you're protecting, when you're wearing a mask, know that you're not only protecting yourself, but you're also protecting other people. So it's about being responsible for the health, your health, and other people's health. And the second thing is around accountability and transparency, especially when it comes to funding that has come in. We've seen a lot of funds from our development partners coming into our countries. As civil society, first of all, we were not part of those committees, national task teams of COVID. And secondly, when the funding was coming in, we may not have been part of process of developing those work plans and budgets. But that doesn't mean that we should not be there to hear and to see if that funding is being, how the funding is being utilized. As civil society, it is our very first responsibility to make sure any resource, whether it's funding, whether it's human, whether it's technology, it is being utilized accordingly. We know that most of the funding that comes into our countries is taxpayers' money from the donor country. And we know as civil society that if this funding is being misused or unutilized, one, it's the community that is being disadvantaged, because at the end of the day, the donor countries know that money is being given to the communities, and yet it is not reaching them. So therefore, it is our role to voice that out. But secondly, it is also to ensure that there is trust in terms of the monies, because today we may use those funds for that activity, but tomorrow we may need more money. As such, we need to be able to account for the monies such that we are able to get another disbursement or another to be replenished. And I'll talk about, like, in terms of the Global Fund, you find that we have a group of donors, and those donors would want to see the money, the impact, first of all, and then secondly, in terms of how accountable the funding has been used and in a transparent manner. And I would like to stress community-led monitoring, making sure that we know what the budgets to our countries are and how the expenditure is looking like, and if that expenditure is meeting the needs of our communities. Thank you so much, Faith, for that question. And back to you, Olaide.
Thank you, Olive, and thank you, Faith, for the question. As you know, there's so many issues to unpack when we're talking about gender and human rights, and we could actually go on and on. But our time on the show is wrapping up, and so we want to say thank you very much for watching. Thank you, Olive, for giving us such a very enlightening expose on human rights and gender and the things that we need to know. Two takeaways from this discussion. Number one, you need to take personal responsibility for your health. And number two, our governments also need to invest in strengthening community systems, because community systems are really closer to the people, particularly the marginalized populations, and can deliver services. So we need to be able to resource communities to do their work better and to reach more people. Again, thank you, Olive, for all of your wonderful insights shared on this show. And thank you, everyone, for being a part of today's show. We want to say a Merry Christmas to you. Enjoy the holidays with your family and friends. And please stay safe and stay protected. Thank you, Olive. Take care. Bye.
Thank you, Olaide. Bye-bye, everyone.
All right. Bye. Take care. Bye.